All right, thank you. I do want to start off by saying how proud I am of the organization and of our community and how they've responded over the past few days. Very much appreciate all the planning that we have done leading up to this point. I think we have come out of the gate very strongly, but time is of the essence, and we are sprinting now for sure. Ultimately, this will turn into a marathon, but right now it's a sprint. You'll see there the agenda. Our report today will include an update on our status and major decisions and where we are with COVID-19, our plan for continuing operations and the continuity of government, and really a roadmap as we've attempted to prioritize the thousands of things that we're doing, and also a little bit about federal and state funding for response and recovery. If I could go to the next slide, please. So we are in stage 5 of our pandemic response plan. Our EOC is fully activated and leading this event. All of our work will be coordinated through our EOC. We will transition between Lee and Kip as EOC leaders. All city facilities except the airport are closed to the public. We have canceled all in-person meetings except for the council and rules. All essential services will continue, and so I want to just stress that essential services means more than just police and fire. There are many services that we need to continue to keep the public safe, to keep our city clean, and so those essential services will continue. I also want to reassure the council as we make decisions under the emergency proclamation, we will be bringing those decisions forward to council for ratification as soon as practical. The update today is intended to provide you with the latest information that we have, and we commit to constant communication with all of you, with the public, and with the workforce through the many channels of communication that we have available to us. Before I turn it over to Kip and Lee, just want to ask again for your patience as we go through different presentations, as we manage the logistics, really trying to minimize the amount of staff that we have here. And so it will take us a minute or two to transition between presentations. So I'm going to pass it off to Kip to continue on with the presentation.
Good afternoon, Mayor and Council, members of the public. Kip Harkness, Deputy City Manager and the lead on our pandemic response. 54 days ago, we initiated our preparations for a possible pandemic of the virus now known as COVID-19. Today, the pandemic is no longer a possibility, it is a reality. I want to walk you through what we now know about COVID-19, how it behaves, and what its possible impact on us as a city and a community will be, and therefore why we have responded in the way that we have. So backing up a little bit, it's important to understand, I'm going to start with kind of the question that we've all been asking, I think increasingly we have a clear answer to, how is this different from the flu? How is this not just another seasonal flu? And it's different in 3 key ways. One, it is much more transmissible than the common flu. So in the flu season, one person might get the flu and on average infect 1.3 other people. COVID-19, you may get COVID-19 and infect 2 or 3 or more other people. So if the number is below 1, you don't have an epidemic because it burns out. If the number is above 1, you begin to have an epidemic. The higher the number is above 1, the more rapid that epidemic will spread. So to go from 1.3 to a 3 is a huge swing in the amount of transmission of a particular virus. Second reason that COVID-19 is different than the flu is it is more deadly than the seasonal flu, especially for older people. Across all age groups, it is approximately 20 times more deadly than the seasonal flu. Finally, reason number 3, it is a recent zoonotic disease, which means it's come across to us from animal transmission. So there is no previous contact with humans. We have no immunity that we've built up over time. There is no vaccine, and there are no for certain medical treatments. So we do not have the pharmacological weapons that we have against flu or the natural immunity that we would have against flu. So for those three reasons, COVID-19 is extremely different than the flu. And I want to give you a non-alarmist but a realistic understanding of the magnitude of the threat and why we are going to be concentrating our response. We do not yet know what the level of this disease will be, and part of what the level of this disease will be will depend on our response to it. Modeling has indicated a wide range of possible scenarios. If you go with a middle range scenario, let's take this. Let's look at things that we all care about: death by homicide, death by traffic fatalities, and death by seasonal flu. And we look at that for a year like 1919. And then we take all of that and we go back and we look 2018, all the way back to 2010. We take a decade of deaths by homicide, traffic fatalities, and flu. Now, if we stack all of those together in a single year, we get about 877 deaths. We expect COVID-19 at a middle scenario to potentially have that many deaths in the next 3 months. So the actions that we take today and that our community takes following Dr. Cody's orders around shelter in place could have as much effect on people's lives and safety as 10 years of effort around traffic safety, homicide, and flu prevention in normal times. So this is no ordinary time, and this is why everything we are doing is focused on the response. So what we know about this is that the epidemic progresses in a high and to the right way. It has exponential growth. We've seen this in China. We are now beginning to see this in Europe and in the United States. We also know that for most of us, the cases, if we catch it, will be mild, about 80% or more. However, there are a significant number of severe cases which will require attention and medical care. And most importantly, about 5 to 6% of the cases will be critical and require significant medical attention. In particular, the current therapies require ICU, intensive care unit, and ventilation, intubation, the insertion of a tube down the throat to provide ventilation capacity for somebody whose lungs are no longer fully functioning. That becomes a critical pain point, and we'll come back to that later. It is those 5% that are critical are the ones that we need to pay attention to the most. So who does it kill? It disproportionately affects people as they age. Beginning at age 50, you see a stepwise increase decade by decade, 60s, 70s, and 80 plus, until by the time you get kind of to 65 and above, this is a very deadly disease. So that's what we know from the epidemic in China. Those numbers will shift and change as we come here, but they are a good proxy for what we are going to see. So where are we in the United States? Well, we are moving through that exponential growth curve, high and to the right. Where are we in Santa Clara County? We are experiencing a similar growth. If you plot our cases against an exponential growth curve, it fits 98.6%, which means that we are seeing exactly the kind of exponential growth that we would expect. That means we are about 35% growth estimated in the county, which means a doubling of the number of cases every 2.2 to 2.3 days. And then another doubling in 2.2 days from that, and then another doubling in 2.2 days for that. The doubling stops when the disease runs out of people to infect, either by spreading through the entire population or because the population has isolated themselves and it can no longer transmit from one to the other. So if we use what we know about other countries to look ahead, it's a bit hard to see on this screen, but that dotted line that's hatching through all the way to the top is the 35% growth rate. You see that some countries like Singapore, the green line across, and Japan have managed to get some control over the disease by very, very aggressive containment. We are unfortunately past the point of being able to have effective aggressive containment at that level, but we can still have potential mitigation measures. South Korea, for example, has bent the curve pretty rapidly with their response, and China was ultimately able to do the same. At this point, using Italy as a proxy, you can see that we are perhaps weeks behind Italy at best, perhaps a week behind Italy at worst. And so that suggests that we are potentially in a situation similar to Italy where the stresses on our healthcare system are imminent. And I'll get into that in just a moment. So part of what's difficult about this for us is our lag in testing. Here you see two graphs. The reddish one of the circles is the population, and the blue circles is the testing per capita. And so you can see South Korea and China have done massive testing per capita. We have done only a blip. These numbers are starting to improve, but they have improved late. And what that means is we have a limited and delayed understanding of the situation of COVID-19 in the United States. And statistically speaking, that suggests that the spread is probably worse than we know, and that containment is, in its purest form, is likely no longer possible. So you may have probably all seen a version of this, flattening the curve. So the idea at this point is that we need to flatten the curve. We need to take it from being a high and to the right epidemic that overloads our medical response system and other systems, and we need to slow and reduce the spread of the disease so that it flattens out and we're able to manage it better over time. Unfortunately, the problem with a graph like this is it lacks actual data and therefore presents a slightly more optimistic picture of what is possible. The dotted line you see going across from right to left is healthcare capacity. And this graph optimistically shows us being able to flatten the curve below healthcare capacity. At this point, healthcare capacity is not a general thing. It is specific to the critical cases that I spoke of earlier. So the critical pain point in healthcare capacity is the capacity of ICU units and ventilation units to deal with the most critical cases. In the absence of ICU and ventilation, those critical cases will die. So that is the limiting factor on our ability to respond to the disease as it becomes an epidemic. The reality is that dotted line, if we were to make one for Santa Clara County, would be much, much lower. We are already running out of ICU capacity, and the county is working to rapidly expand what they have and have on access. But as of a couple of days ago, we only had 11 vacant ICU beds in the entire county. So that dotted line is much, much lower than you see on this. The other thing is flattening the curve is really, really difficult because the rate of transmission is so high. However, the very best thing you could do to flatten the curve is exactly what Dr. Sarah-Cody has ordered us to do. Stay home. If everybody actually follows the orders, in 3 weeks, the course of this pandemic could be completely different. It runs its course in most people in 2 weeks. So if we are able to keep everybody isolated in their home and social distance for a 3-week period, it is quite potential that we could significantly flatten the curve and reduce and slow the spread of disease. If we do not, every day that we do not is an exponential increase in the amount of disease and a stress on the healthcare center. So with that as context, Santa Clara County is focusing as much of their resources as possible on the public health response and on the medical response, for which they are both the lead and primarily responsible. They have asked us, in an unprecedented fashion, to take responsibility for some of the other things that would normally be county responsibilities so that they can relieve pressure and refocus their resources on those top two. The one that they formally asked us so far is to take the responsibility county-wide for efforts on food distribution and food security, including feeding people who are self-isolated or quarantined, resolving food supply, chain disruption issues, and coordination on food issues with other cities, unincorporated areas, private sectors, and community organizations. So that becomes the basis for our response, which is what we'll go to now and talk a little bit more about how we responded. But I wanted you to understand the context of the disease and the severity of it and the reason for the drastic nature of our actions today. With that, I'll turn it over to Lee, who will walk through our operations and the framing of our response.
Thank you, Kip. Yeah, you should probably keep that. So as a city, and as we walked through at our last study session together around emergency preparedness, a lot of emergency preparedness is planning and being ready. And one of the terms you'll hear a lot today is COOP, and that really refers to a continuity of operations plan, and a governmental plan or a business plan, quite frankly, that's done within emergency management. And for us, the city must ensure continued operations of essential services and shift the organization to respond to the city's pandemic plan that KIP has outlined and the county's needs. And we'll do that with this COOP. As a reminder, the city's pandemic plan, we've talked about 4 principles. And over the weekend, Kip and I made the decision where we added a first to this list, which is slow and reduce the spread of COVID-19. We're shifting a lot of the principles and organization to do this and to support the county and Dr. Sarah Cody's orders. And so with that, we need to do these 5 things well, continue to do essential services for our community. And we've done that over the past few weeks. Next slide. And really started to implement and walk into these things over the weekend. So as Dave mentioned, at 12:45 on Saturday afternoon, the city moved into stage 5. And that really came to be with a full activation of the EOC as well as starting to shut down essential city services. And we started that over the weekend. Extremely high risk to the general public. We've seen that come to fruition over the last few days, as well as our full activation and the COOP planning and how we step into that is some of what we'll talk to you about right now. Next slide. So what is a COOP? It's important for you guys to know, or continuity of operations. It's really focused on the organization and the administration. We will be touching upon your role in that as well. But it establishes the policies, guidance, and ensures that critical city functions like our essential services while abiding by the county orders protecting staff as well as protecting public. So it's with this eye we put our continuity of operations plan in place. It's important that we take this step. We need to protect our people to do the essential services and to pivot our organization to help with the response. We'll do this by halting or slowing non-essential services so that we can prioritize most important. And we've also looked at this through the lens of the COVID-19 environment and how that plays a particular new role in how we do some of this planning. It's not an earthquake, it's not a flood, and how we keep things going. It's very particular in how we enter into this environment and support the county and our public. Next slide. So overview of the city's COOP. Dave mentioned some of these, but just as a high level so you know, employees must work remotely unless they are performing an essential service that must be performed on site. So very important that our staff has the flexibility to work from home where appropriate, and where they need to be in performing an essential function, if they can't do that at home, we are taking all social distancing and healthcare expert advice into creating an environment at City Hall for our workforce to be safe. All city facilities have been closed to the public, with very few exceptions under the Brown Act, such as today where council chambers and the rotunda is open to the general public, and that all meetings have been canceled. Accommodations will be made to hold essential meetings virtually, and we're doing that throughout the organization. I know a number of departments are meeting right now via Zoom, and where appropriate, we'll also be doing that for community meetings. Next slide. Our criteria over the past few weeks, and as we started to implement over the weekend, is the frame of this virus and the criteria that we need for our essential services, and really looking through what does our community need to be healthy, what do we need to be engaged and safe. And so we've done that over the past few days. This is a difficult task as a large organization and with an evolving situation. So our continuity of operations plan will continue to modify and shift as we know more about what is in our environment, as testing ramps up, and as we begin to accomplish some of the most pressing needs in our community. Our framework over the past several days as we've been implementing is what essential services can be provided off-site or remotely, what needs to be done on-site, and what services can be suspended to focus on implementing and supporting the county and our own city's pandemic plan. Second, continuity of government. Very important. Principle, we need to have a principle of establishing defined procedures that allow us, namely you, as our legislative body, for continued legislative approvals to support our own continuity of essential operations and services, as well as our COVID-19 response. And that's how this be done. So there have been relaxations, which we'll go over in a second. Can you go back? So for council meetings, they do need to be, we do have flexibility with some of these new guidelines. Council member attendance for council meetings can be done virtually. As we step into this, and as Dave mentioned, some of this needs to be worked out. We will have IT support for all of you in the coming days if you wish to participate virtually so that we can do that. Under the Brown Act relaxations, which will be taking up, we still do need to have an in-person place for our general public within social distancing guidelines for them to take effect. So the principles that we've implemented today adhere to these, where they're in the council chambers. Second, closed session. Council members will also be able to participate virtually. And again, any IT needs you have, we will be following up on that as we move forward. Next slide. Our Rules Committee will also follow a similar model as council. And the Rules Committee does need to set or meet as it is the agenda setting body for this organization. So Rules Committee will continue to meet in person or virtually, and we will have gathering places for public participation with social distancing guidelines in effect as we move forward. It's important that we both have a Rules Committee and the ability for the council to meet, so we can continue to bring legislative actions or budgetary actions needed for us to implement our continuity of operations plan, as well as our overall response and support of the county and our community. Lastly, all other council committee meetings will be canceled through May. We'll be taking this up and manage that process and the work plans through the Rules Committee next week. And a vast majority of commissions and boards will be canceled as well. We do have some charter responsibility with the planning commissions who are working to hold those virtually as well. And we will be communicating out to the public related to the planning commission process once that's finalized. All other commissions have been canceled through May as well. With that, I'll hand it back over to Kip.
The situation we find ourselves in requires us to have an agile response. And so we have used some of the tools of this valley to craft our roadmap through this epidemic with a focus on slowing and reducing the spread of COVID-19. As I spoke to you last time, we have about 40 different items that we are working through, and we realized that while all of those were important, the need to prioritize them and to have a laser-sharp focus on what is most important has become very, very clear. And so we took those 40 items, reduced it down to about 24, and then spent several hours with key members of senior staff working through and understanding the impacts to the community, the risk around each one, the complexity and duration of each one, as well as the time criticality. And that resulted in the roadmap you see before you with these 10 as the absolute top priority of what we are focusing on now. Conceptually, what I would suggest is you think about this as 12 weeks. We are going to be in this, whatever it is, for at least the next 12 weeks. But we can't do everything we need or want to do in 12 weeks right away. So the question is, looking at the whole, what do we begin to do now, in this week, that has the most impact to our community in a positive way or reducing risk? And so you see at the very top the two things that we are focusing on most is city continuity of operations of essential services, so that people can do the shelter-in-place order, that their garbage is picked up, the wastewater continues to flow, where we provide water, it continues to flow, fire and police are able to respond, all of the things that are necessary for people to live a normal life while they are sheltering in place. Second is the enforcement of the public health order, encouraging folks, communicating with folks positively, and where encouragement doesn't work, requiring them to comply with the order, which is for the safety of all of us. In order to do that, we need to make sure that our staff, our employees, are safe and are able to continue working in a healthy condition, and that's our first responders and our essential staff. And then you see the rest of the items are either in support of those or a more defined focus of some of the most vulnerable communities. As we went over earlier, you see that the risk of death is highest among our seniors and those who are medically vulnerable. And also we know that our homeless population is particularly susceptible to epidemics in general, and this type of epidemic in particular. So seniors, medically vulnerable, and homeless are particularly important populations that we are paying attention to and designing our work to respond and support them in their moment of need. Other additional things that come to the top are food distribution and feeding, which, as I mentioned, we've been asked to take on county-wide. Housing for those who are quarantining or self-isolating, who may not have housing or adequate space in their housing to do so safely, and small business support. And then there are a range of enabling actions we are taking in service of that top 10. Everything from our communications, mobilizing nonprofits and volunteers, scaling our telecommunications capability, reassigning non-essential staff to the essential tasks and the emerging priority items, and campaigns that we may launch in support of all of this to mobilize volunteers and resources. Now, there are additional items that we continue to do. We are not stopping these. These are not paused, but they are not at the same rate or focus as those top 10. Things like understanding state, federal advocacy, putting together local assistance for individuals, homeless prevention, preparing for any civil disturbance or hospital triage, child care, recreation services for the broader community, and school children and family support. Now, all of these are important. All of these are vitally important. But if we fail to stop the spread of this disease, and if we fail to provide for continuity of operations, and if we do not have healthy workers, we will not be able to move on to these second-order issues and problems. So our first-order priority is the health and safety of the community through the continuity of operations and through the enforcement of the public health quarantine. And again, you see at the bottom, each of these we evaluated, debated, and discussed around how valuable is it to the community, what are the opportunities or risk, what is the time criticality, and job duration, how can we simplify and get something out. The one I want to pay attention to is time criticality. This is the notion of what needs to be done now that we can't do later. And this is one that is in crisis like this, you have to be relentlessly clear about. We understand, because of the exponential growth of the virus, that anything we can do to prevent the spread of it or reduce the spread, the time for that is now. If we wait a day, then it's another 1,000 people who we have to deal with who are infected, and the healthcare system has to deal with 5% of those. And all of those people have to be in ICUs. So that is the reason for our prioritization. Everything on this list is important. We care deeply, deeply about the people who are affected economically by this. But for week one, our priority and focus for the mass result of our effort is on continuing our services and making sure that the good measures that Dr. Cody has ordered are able to be put in place and stop, if possible, or slow, if not, the exponential growth of this disease. So again, that's our roadmap. We will be translating this into is already translated into our emergency action plan. We'll have a week-by-week cadence, so we'll be able to adopt and modify as conditions change and as we learn more about both the needs of our community and the response. And so things that are on this list this week may change next as we're able to clear out some of these, but it will be a week-by-week cadence because the amount of unknown is so high, but with the idea of looking about 12 weeks into the future and trying to do what is most important now over that long haul. I guess 12 weeks feels like a long haul at this point. So with that, I want to turn back to Lee to talk about some of the stuff that is coming down in terms of federal, state actions and how we're hoping that will lend us more resources both for our response and also for the local assistance and support on the economic side, which we know is terribly important.
Thank you, Kip. An important part of our prioritization is understanding the full context of what the federal and state government are doing in the way of how resources will come in, when they'll come in, and what type of specific programs they might be earmarked for. So as we mentioned last week when we talked about this, we've really stood down the entire intergovernmental relations program and focused simply on this, not only so that we have the resources in the communication to the state and federal government for this response, but also that we can much more proactively start now on the recovery piece so that we can be proactive to our community. So any type of impacts can be mitigated through shorter periods of time. A lot of this at the federal government started on March 6th when the president signed the first funding package, H.R. 6074, which is $8.3 billion. That was followed a few days later by declaration of a national emergency with immediate FEMA release funding coming into cities where FEMA and the federal government will cover 75% of expenses, the state covering 18, and local municipalities covering 6.5. It also frees up existing funding to be much more flexible to respond to the virus and cities' response to that. Next slide. Second, it's currently in progress, but a second package, H.R. 6201. Hopefully, I don't believe the Senate's voted on it today. I could be wrong. But it changes family and medical leave, as well as has started to look at the way paid sick leave happens for part-time employees as well as full-time. It includes additional funding for senior nutrition programs throughout the country, and unemployment insurance, providing up to $1 billion for states for unemployment testing, as well as free COVID testing when available. A third package is being worked on by by Democrat and Senate Republicans right now, and will hopefully be heard sometime by the end of the week. Next slide. On the state side, on March 4th, the governor did declare an emergency declaration allowing the state to release funds to local governments. And on the 16th of this month, the governor requested emergency legislation to provide up to $1 billion for this recovery effort. Those bills are working through the state legislature now and allocates $500 million for the response, which is an increase by $50 million, possibly up to $1 billion. And funding priorities include local governments to reduce the spread of the virus within our homeless or unsheltered population, providing hotel beds for people existing homelessness, as well as $100 billion for local school districts on preventative equipment for cleaning the schools. So these are evolving issues both at a federal and state level. We will do our best to funnel this information and the resources that come into our response through the Emergency Operations Center, and also engage you as the mayor and council on the help that we need for advocacy at both levels. With that.
Yes, so thank you, Kip and Lee. So that concludes our presentation. We can certainly take questions. We're not looking for direction with this item, but we are listening to you.